All right. In this particular section, we will look at some antifungal drugs. Most of the antifungal drugs mainly work by targeting molecules that build the plasma membrane. So they pretty much either will inhibit the synthesis of plasma membrane or they will injure it. So I'm going to go ahead and write it will either injure or hang on, messed up on the spelling. Okay, so there will be an injury to plasma membrane, which is P, or it would be the inhibit the synthesis of plasma membrane molecules. So once they do that, they will destroy the pathogen cell, and it will not be able to grow on the host cell. Here is an example about an antiviral drug, such as nucleoside and nucleotide analogs. And these antiviral drugs I should have had a label up here. These are all antiviral drugs. They inhibit the synthesis of DNA by blocking the synthesis of DNA polymerase for synthesis of the DNA. Again, these are primarily used against certain viral drugs such as herpes viruses and certain other infections that, for example, it may also affect infections against smallpox, for example. And some of these may be affected in treatment of the flu virus by inhibiting the coating of the plasma membrane. The most widespread antiviral drug, as you may have heard of that, and that is called as the interferons, are the most effective antiviral drugs, and they inhibit the spread of virus to the new cell. So pretty much it will inhibit the attachment of the virus to the cell. How are all these studies done? So here is a little image of something similar that we also did in class, in which you were asked to put a little disc that had the antibiotics on them, and the presence of this clear zone, as you can see up here, indicates how good that organism is, how good it is in combating or inhibiting the growth of the microorganism that is swabbed on this agar plate. So the more clear zone it is, that is susceptible to that particular drug. Here is a drug that is shown to you that is totally resistant to. Here's another one that's resistant to. One other way of doing that is to actually measuring on a scale. There's a plastic strip that is shown to you that's placed on the agar surface, and actually it increases an increasing gradient of the antibiotic. So the wider it is, the further away it can go in, you will have more susceptible drug. Now, there's also an effect of the drug where you have two drugs that can affect each other, and one effect is called as synergism. That is, it occurs when the two drugs together give you a greater effect. So, for example, as I said earlier in MRSA, synergistic effect is drug in which two different drugs are put together. Antagonism is when the effect of two drugs together is less than the effect of one alone. So you have to be careful when you give drugs, whether it's synergistic or whether it's antagonist. If it's an antagonist, it's doing more harm than it's doing good for that particular disease. So what is next? I thought this was a nice little cartoon that I wanted to show you. It was on the shortcut through the hospital kitchens that Albert was first approached by a member of the antibiotic resistance, and you can say that he's saying that wanna be superbug, stick some of this into your genome, even penicillin won't do you a harm. So that's what a little humor up here. Is there a downside to antimicrobial antimicrobial use? Oh yes, definitely. We all know what that is. That is because you have the rising number of MRSA in many hospitals, and you can see up here compared to 1994, where MRSA was very few patients had it, almost 5, and look at the number by 1998. It's like almost 70% of the people or 80% had it. And the reason for that is that people have misused the use of antibiotics. That is when they do not take the full prescription. And secondly, it has been overprescribed. That is, they do not work on viruses. So when people are just commonly sick with just a common cold, and they are always demanding the healthcare physicians to give them antibiotics, it will result in overuse. What types of resistance are there? So in this one, I just wanted you to get to see different kinds of resistance. For example, decreased permeability, activation of drug pumps, changes in drug binding site, and use of alternative metabolic pathways. So again, these are different types of resistance that can grow, that can be produced. Actually, I'm trying to see, did I miss one? I think there's one. Yeah, no, there isn't. Okay, so those are the different kinds of permeability that you can get, different kinds of resistance that can be acquired with the use of over prescription of the medication. Okay, here is an image with a graph that you can show the inhibition of antibiotic therapy when you have the antibiotic resistance of the bacterial population measured by the amount of antibiotic needed to growth. You can see how drastic it has gone down. If you use an initial antibiotic therapy, your count will be low. However, if you have antibiotic resistance, notice that it doesn't totally remove the number of bacterial cells, or doesn't kill them. And the resistance up here again is the entry block, activation of the enzymes, target molecules that have been changed, and the efflux of antibiotics. So these are just a number of targets for the action of antibiotics is limited, and these are the mechanism by which bacteria are either resistant to antibiotics or they're limited to them. And these 4 major mechanisms were discussed in this chapter earlier, and just gives you an effect of how much variations on these mechanisms can occur, and a microbe can become resistant to drugs, for example, trimethorphan, by synthesizing very large amount of the enzyme against which this drug is targeted. So something to be aware of. And our last slide up here is, what is the future of the chemotherapeutic agents? Now, the future of these is that there are many peptides that are coming up in the future. These antimicrobial peptides are essential to the innate systems of many birds, amphibians, plants, and mammals, and they're produced there. And these, in fact, are part of the defense systems of most form of life. So as the resistance will continue to develop against existing antibiotics that have relied for such a limited range of target, our focus is now going to be towards antimicrobial peptides, which will be shorter chains, and the primary factor in here is that it will allow to disrupt the microbial membranes that are rich in phospholipids with certain negative ions in them. So broad spectrum antibiotics such as niacin, megninin, which are present in frogs, and carfaprin, which are present in moths. Another new approach is the use of short synthetic strands of DNA, which are called as the antisense agents, and they will bind to a pathogen's virulence genes and thus prevent transcription. An example of that is formamycin, which is used to treat CMVs. And lastly, it is the presence of of this agent, which can be blocked, which is actually a protein synthesis in pathogens, can be blocked by molecule that is called as RNAi interference. And I'm not going to go into a whole lot on RNAi interference, because RNAi interference is very interesting, and we can almost do a chapter on RNAi interference. RNAi is basically a complementary RNA that will bind to the messenger RNA to then inhibit translation. So these are some of the future of the chemotherapeutic drugs that are coming up, because many bacterial diseases previously that were treatable with antibiotics have become resistant to antibiotics. So just know that these are three of them: the antimicrobial peptides that are produced by plants and animals, and they provide new agents. Then we have the protein synthesis that was dropped by RNAi, and then complementary antisense strands that will bind to the DNA. So this concludes our chapter on antimicrobial drugs. Hopefully you've enjoyed microbiology, and hopefully the information that I was able to relate to you throughout the semester will be useful in your future. Good luck and good wishes for the future.